Hello everyone, welcome to my YouTube channel. This is Sir Steven, and for the first installment of our medical histology laboratory series, we will delve into the intricate structures of your human body, specifically your head and the neck. Today we will start our discussion focusing on the delicate and essential components using the micrographs of the head and the neck. This is our medical histology laboratory series, and the part 1 will be containing your eye and the ocular agnexa, your oral mucosa, your gingiva, and your teeth. Now we will go into your eye and your ocular agnexa. In your eye, macroscopically, this is composed of a globe, a spherical hollow body of eyeball. We have also your cornea, which is a transparent outermost structure. It refracts your incoming light. We have also your iris, which is a membranous diaphragm with a central opening. We call it the pupil. We have also a lens, which is a biconvex crystalline structure, which focuses light on your retina. The anterior chamber, which is an area between the posterior cornea and anterior iris. Your posterior chamber, which is an area between your vitreous body and the posterior aspect of iris. Your aqueous body, which is a clear fluid filling anterior and posterior chambers. The vitreous body, which is a gel-like material filling the posterior cavity of your globe. We have your sclera, which is your white, tough outer covering of the globe. And your retina, which is a complex organization of nerve cells and processes. It translates light into electrical impulses to your brain via your optic nerves. And this is a diagram, a schematic diagram showing you the different components of your eye. Number 1, we have your vitreous body. Your number 2, ora serrata. 3, ciliary muscles. Your 4, the ciliary zonules. Your 5, the sclems canal. Number 6, pupil. Number 7, your anterior chamber. Your 8, the cornea. Number 9 is your iris. Your 10 is lens cortex. 11, lens nucleus. The 12 is your ciliary process. The 13 is your conjunctiva. The 14 is your inferior oblique muscles. 15 is inferior rectus muscles. 16 is your medial rectus muscle. Number 17 is the retinal arteries and veins. The 18 is your optic disc. Your 19 is your dura mater. 20 is the central retinal artery. 21 is central retinal vein. The 22 is your optic nerve. 23 is your vorticose vein. 24 is your bulbar sheath. 25 is the macula. 26 is the fovea. 27 is sclera. 28 is choroid. 29 is the superior rectus muscle, and the 30 is your retina. So in your microscopic anatomy, it consists of your sclem canal, your descemet membrane, your Schwalbe ring, a ciliary body, and the choroid. We have also the retina, which is consisting of 8 to 10 layers. We have the nerve fiber layer, the ganglion cell layer, the inner plexiform layer, your inner nuclear layer, your outer plexiform layer, your outer nuclear layer, your rods and cones, and the retinal pigment epithelium, which is the outermost layer. So we will go into the different diagrams and the micrographs, starting with the anatomy of the globe. On your left is illustrating the globe in a sagittal section. Your globe is supported by the muscle in a curved black arrow and adipose tissue in a bold black arrow. This connects to the brain via your optic nerve in single blue arrow. On your right, in this sagittal section, we have your cornea, which is in a curved blue arrow, your iris in bold black arrow, the lens, single black arrow, the vitreous body in curved black arrow, and the ciliary body in bold blue arrow can be identified. The anterior chamber is the space between the anterior iris and the posterior cornea, and the posterior chamber is here on your right, is comprising the space between the vitreous and the posterior aspect of the iris. On your left is a low power field of your posterior globe and the head of the optic nerve pointed in curved black arrow, the retina in bold black arrow, the choroid, single blue arrow, and the sclera in black single arrow can be identified. On your right is the anterior chamber of the globe, which is situated in between the posterior cornea in black single arrow and the anterior iris in bold black arrow. At your low power, the lens is composed of eosinophilic material, which is shown here in curved black arrow. The iris sphincter is constricting and dilating to adjust the amount of light that the lens is allowed to focus on the retina. On your left is the corneal epithelium, which is a non-keratinizing stratified squamous epithelium with nuclei present in all layers. The basal layer in curved black arrow of your epithelium is composed of larger, more columnar cells, and as the cells rise to the corneal surface, they become more flattened as shown here in single black arrow. On your right is the corneal epithelium in curved black arrow that rests upon a thin basal lamina, which is stained bright pink in this periodic acid shift preparation in bold black arrow. The acellular band, which is beneath the basal lamina, is the Bowman layer that is pointed in blue single arrow. On your left is the corneal stroma, which is composed of regularly spaced collagen fibers embedded in an extracellular matrix. Of note, there are no blood vessels or lymphatics that are present in the corneal stroma. The cleft-like spaces in curved black arrow are secondary to tissue fixation and processing. On your right is the posterior cornea, which is lined by a single layer of the cuboidal endothelium that is pointed in blue curved arrow, which is a misnomer as it does not line a vessel. The descendant membrane in a bold black arrow is the basement membrane of the endothelium. Next, on your left is the junction of the cornea in a curved black arrow and the sclera in single blue arrow, which is known as the corneoscleral limbus, as seen here. The corneoscleral limbus is an important surgical landmark and posteriorly contains several structures in bold black arrow. These are vital to the flow of the aqueous fluid. On your right is a normal age-related changes that are seen in the descemet membrane, consisting of focal thickenings in bold black arrow. We call it Hazel-Henle warts that appear to alternate with the posterior endothelium, which is pointed here in bold black arrow. On your left, on the next image, is the corneal stroma in curved black arrow and your iris in single blue arrow. This can be seen forming the anterior chamber angle in bold black arrow. The canal of Sclem in bold blue arrow is anterior to the iris. As the corneal stroma blends into the sclera, delicate blood vessels that are absent in the corneal stroma can be identified as pointed in black single arrow. On your right is the episclera, which composes the outermost layer of the sclera. It contains more numerous blood vessels in bold black arrow admixed with collagen and fibroblasts in curved black arrow. On your left is the middle portion and the bulk of the sclera, which is the scleral stroma. The stroma is composed of varying sizes of collagen fibers admixed with elastic fibers. Within the stroma, rare fibroblasts in curved black arrow and blood vessels in bold black arrow may be identified. On your right is the lamina fusca, seen here under the scleral stroma in bold black arrow, which composes the innermost layer of the sclera. The lamina fusca is composed of melanocytes in a single black arrow, collagen, and fibroblasts in curved blue arrow. On your left, these are blood vessels in bold black arrow, and fibroblasts in single blue arrow are present within the sclera. The episclera in curved black arrow is located at the top of the image. Aqueous fluid from the anterior chamber circulating through the trabecular meshwork in curved black arrow and drains into the canal of Sclem in bold black arrow. From there, it flows into the episcleral venous plexus via the aqueous veins. A blockage of the aqueous flow at any of these points may lead to increased intraocular pressure and glaucoma. On your left is the Squalby ring, identifying the termination in curved blue arrow of the Descemet membrane in bold black arrow peripherally. The trabecular meshwork in black single arrow begins immediately beyond the Squalby ring. On your right is the conjunctiva, which is a bold black arrow, the thin transparent lining relatively covering the inner surface of the eyelid, which is the palpebral conjunctiva, and reflected onto the anterior surface of the globe, which is the bulbar conjunctiva. Its function is to allow the eyelid to slide smoothly over the globe. On your left is an occasional aggregate of lymphocytes in bold black arrow that may be identified within the conjunctiva. Lymphoid aggregates tend to be more common in the area of superior and inferior fornices. They are not a sign of chronic infection. On your right is a portion of the conjunctiva overlying the sclera in curved blue arrow, which is known as the bulbar conjunctiva in single black arrow. The bulbar conjunctival stroma is composed of loose connective tissue in bold black arrow. On your left is the conjunctiva terminates anteriorly at the beginning of the squamous linings of the eyelids. This is in single black arrow. The conjunction of the palpebral conjunctiva and the bulbar conjunctiva occurs in the superior and inferior fornix, the openings of which can be seen here in bold black arrow. On your right is the palpebral conjunctiva in curved blue arrow and the bulbar conjunctiva in single black arrow that are meeting in the fornix in bold black arrow. It is in the region that the lymphoid aggregates and abundant epithelial goblet cells can be identified. Next are your goblet cells in bold black arrow that are seen in this fornicial conjunctiva. Goblet cells are large mucin-containing cells with gray-blue cytoplasm and basal nuclei. This mucin helps to lubricate the eyelid and the conjunctiva. On your right is the iris in bold black arrow that can be seen in the middle of these H and E. The origin of the iris or the iris root in curved blue arrow is from the anterior ciliary face in a single black arrow. Smooth muscle fibers in the iris causing the pupil to constrict and dilate, regulating the amount of light entering the lens. On your left is an iris, which is composed of connective tissue, smooth muscle in curved black arrow, blood vessels in single blue arrow, nerve cells, and melanocytes. The number of stromal melanocytes determines the color of your iris. The posterior epithelial lining is heavily pigmented in white bold arrow. On your right is the epithelium that lines the ciliary body, which is composed of two distinct layers. The innermost layer, which is in bold black arrow, is non-pigmented and abuts the posterior chamber, while the outer layer is pigmented in curved blue arrow and adjacent to the ciliary body stroma, which is in a single black arrow, as shown on the right figure. On your left is the thin acellular eosinophilic zonular fibers in bold black arrow that may be identified extending from the pars plana of the ciliary body to the lens equator. The zonular fibers anchor the lens to the ciliary body and decreases in zonular tension, allowing alterations in the lens curvature. On your right is the fold-like pars plicata that can be seen here in curved black arrow. The fibrovascular course of the pars plicata in a blue single arrow will produce the aqueous humor. On your left is the amount of stroma present in the pars plicata as it increases with age. In this section, the stroma is thickened and hyalinized in single black arrow. On your right is the ciliary muscle, which is the smooth muscle in a bold single arrow that forms the bulk of the ciliary body. Although histologically difficult to distinguish 3 layers of muscle, we have the inner circular middle oblique, the outer longitudinal are present here. Contraction relaxes the zonular fibers and allowing the lens to change its shape. On your left is the interspersed within the smooth muscle of the ciliary body, which has numerous pigmented melanocytes in bold blue arrow will be identified here. On your right is the choroid, which is beginning posterior to the ciliary body and terminates at the optic nerve. It lies between the retina and the sclera. The choroid is composed of vessels with interspersed melanocytes in black single arrow and fibroblasts. Bruch membrane in curved black arrow is the basement membrane for both the choriocapillaries in single blue arrow and pigmented retinal epithelium. On your left is the ora serrata in bold black arrow, which is the anterior termination of the retina. The neurosensory retina in curved black arrow is contiguous with the non-pigmented ciliary epithelium in single blue arrow. The 10 retinal layers on your right are as follows. Number 1 is the internal limiting membrane. Number 2, the nerve fiber layer. Number 3, the ganglion cell layer. Number 4, the inner plexiform layer. Number 5, the inner circular layer, rather. Number 6, the outer plexiform layer. Number 7, your outer nuclear layer. Number 8, the external limiting membrane. Number 9, the rods and the cones. Number 10 is the retinal pigment epithelium. On your left, grossly the macula lutea appears as a yellow spot within the retina. The macula is a region of the retina that can be identified histologically. And this is the ganglion cell layer, which is greater than 1 cell thick, as seen here in bold black arrow. On your right, away from the macula, the ganglion cell layer thins. This image of the peripheral retina shows only rare ganglion cells in bold black arrow. On your left is the optic nerve. This structure pointed in bold black arrow exits the posterior aspect of the globe. Note the absence of nuclear layers of the retina overlying the most anterior aspect of the optic nerve in curved black arrow, leading to the presence of a physiologic blind spot. On your right, a cross-section of the optic nerve shows the nerve in curved black arrow centrally, surrounded by a thin pia mater, the arachnoid in a blue single arrow, and the much thicker dura mater in bold black arrow. On your left is a high-power examination of the central portion of the optic nerve, revealing glial cells in curved black arrow and nerve bundles divided into fascicles by the delicate fibrovascular septa in bold black arrow. On your right is the high-power cross-section showing the central artery in a curved black arrow, and vein in bold black arrow. These structures can be identified in the middle of the optic nerve in its most anterior aspect, extending to the head of the nerve, entering and exiting the nerve 1 to 1.5 centimeter posterior to the globe. Next is your lens. On your left is a low magnification H and E of the anterior globe, illustrating the lens in blue bold arrow lying posterior to the iris, in single black arrow anterior chamber in curved black arrow, and the cornea in curved blue arrow. The pupil consists of the opening within the center of the iris in bold black arrow. On your right is the equator of the lens, which is located peripherally. In this area, the monolayer lens epithelium lining the anterior lens in a black bold arrow. It elongates to form the lens fibers in single black arrow and small clefts in the lens stroma in bold blue arrow are secondary to specimen processing. On your left is a thin carbohydrate-rich lens capsule in curved black arrow which encircles the lens, and the equator is the site of attachment for the zonular fibers that connect these lens to the ciliary body. The lens capsule is the basement membrane of the cuboidal epithelial cells in your single black arrow. On your right is the posterior aspect of the lens that lacks an epithelial layer. Since only anterior epithelium is present postnatally, the anterior capsule thickens with age, while the posterior does not. On your left is the equator of the lens in single black arrow is in close approximation to the ciliary body in bold black arrow and held in place by zonular fibers which are invisible at this magnification. The iris can be seen as anterior to the lens in curved blue arrow. On your right is nearly acellular transparent vitreous in bold black arrow which fills the area posterior to the lens, extending circumferentially to the multi-layered retinal epithelium. This is in bold single arrow, the black single arrow. The vitreous is a gel-like substance principally composed of water and hyaluronic acid. On your left is the section of the eyelid which demonstrates the palpebral conjunctiva in single black arrow merging with the epidermis of the anterior eyelid in curved black arrow. The eyelid contains many structures including the orbicularis muscle in single blue arrow, glands and cilia, which is the eyelashes, in bold black arrow. On your right is one of the most abundant types of glands in the sebaceous meibomian glands in single black arrow, which are found in the tarsus of the posterior portion of the eyelid. Here, the acini of your meibomian glands are seen in association with a central duct in bold black arrow. On your left is the glands of Moll in black bold arrow, or apocrine glands that drain via a duct in single black arrow into the hair follicles that make up the eyelashes. The glands of Zeiss in curved black arrow are sebaceous glands that may be found in the same area and drain into the hair follicle in bold blue arrow as well. On your right, accessory lacrimal glands in bold black arrow may be identified within the most superior and inferior portions of your eyelids at the bases of the tarsal plates in single blue arrow, and in also the superior and inferior fornices of your conjunctiva. On your left is the tarsus or tarsal plate is composed of dense collagen in single black arrow and is present in the posterior aspect of the eyelid. It contains the meibomian glands in curved blue arrow. On your right is the lacrimal glands, which are composed of serous type cells in bold black arrow that drain into a central duct in single blue arrow, the glands are found within the superior lateral orbit. On your left, tears that are draining from the lacrimal ducts into the fornices of the conjunctiva and lubricate the anterior globe surface. The tears will drain into the punctum canaliculus, which are the opening of the pointed here in bold black arrow, which is situated in the medial aspect of each eyelid. On your right, the tears will drain from the punctum canaliculus into the lacrimal canaliculi in bold black arrow. The paired canaliculi, which is composed of one superior and one inferior, are located in the medial portion of each eye. The lining is composed of stratified non-keratinizing squamous epithelium. On your left, from your lacrimal canaliculi, the tears will drain into the lacrimal sacs, where they collect and drain via the nasolacrimal duct into the sinuses. The lining of the nasolacrimal duct consists of a pseudostratified ciliated columnar epithelium, which are pointed in curved blue arrow, with occasional goblet cells in single black arrow. On your right is the orbital soft tissue, which is composed of mature adipose tissue in single black arrow and supporting collagenous tissue in bold black arrow. Small blood vessels pointed in curved blue arrow are also present. Now we move forward with our next structure, which is your oral mucosa. So let's start with the macroscopic anatomy. This is pink, red, or brown in color. This is moist, it has smooth surface, and it lacks appendages as seen in your skin. In microscopic anatomy, this is made up of an epithelium, usually stratified squamous type. These are orthokeratinized in areas which are exposed to high friction like your palate, non-keratinized in most other areas of your oral cavity, para-keratinized as mucosa transitions to skin on lip. Wreath ridges are present. There are also pigmentation, which are composed of your melanin, which is endogenous, and foreign, exogenous. Like when you eat something that has tint or that has dye. Non-keratinocytes, which are melanocytes, Langerhans cells, Merkel cells, and lymphocytes. We have also the lamina propria, which is composed of a dense connective tissue, sebaceous glands, and inflammatory cells variably present. You have also your submucosa. These are dense when overlying bone, periosteum, loose when overlying muscle. It contains the blood vessels and the nerves, and minor salivary glands and ducts are present. This is the image on the diagram, your oral cavity. The oral cavity is lined with the oral mucosa, which is pointed in a single black arrow that are involved in secretion as well as sensations such as touch, temperature, and taste on the tongue. The protective lining transitions from skin to mucosa at the lips and is continuous with the mucosa of your digestive system. Posteriorly, the protective functions are essential, and the mucosa are also the first line defense against microorganisms and infection. On your left is the oral mucosa that are composed of 3 layers. The epithelium in white single arrow with its distinctive wreath ridges, which is easily discernible from the underlying lamina propria in single black arrow. The distinction between the lamina propria and the submucosa is not always as obvious. The submucosa may contain fat, glandular tissues, the nerves, and the blood vessels. On your right is the keratinization of the oral epithelium, which varies with location and degree of friction. This image shows the epithelium from the palate surfaced by orthokeratin, which is flat eosinophilic cells with no nuclei in white bold arrow. On your left, this image is showing an example of hyperorthokeratotic epithelium as seen on the tongue. This appearance is the result of exposure to strong mechanical forces. Note the adherent bacterial colonies in single blue arrow. On your right is the areas with increased friction or areas like the epithelium near the lips that may show areas of parakeratinization. They are characterized by flat eosinophilic cells with retained pycnotic nuclei in bold white arrow. On your left is the color of mucosa varying among individuals, much like the color of the skin. This H&E shows deposition of melanin in single white arrow along the basal layer of the epithelium. The number of melanocytes in a bold blue arrow found in the epithelium is generally consistent from one person to the next, despite color variation. On your right is the H&E showing the blood vessels in curved blue arrow, a relatively large salivary gland duct in single blue arrow, and also a minor salivary gland in bold black arrow within the submucosa. Deep to these structures, the adipose tissue in bold blue arrow and muscle in curved black arrow are seen. Next is your gingiva. Macroscopically, this is a mucosa that cover the alveolar ridge, most closely associated with your teeth or the masticatory mucosa. It is moist, pink, red, or brown with fine stippling. They may be attached or the adherent associated bone or free that forming scuffs around the neck or cervix of the tooth. It also has a gingival crevice, which is a space between the free gingiva and the tooth, extending from the tip of free gingiva or the papilla to the cemento-enamel junction of your tooth. Microscopically, it has epithelium, lamina propria, and your mucoperiosteum. Age-related variation, the epithelium becomes thinner and more fragile with age. This diagram showing you a representation of the relationship of the gingiva to the tooth and the alveolar bone in curved white arrow. The gingiva intimately associated with the bone is referred to as the attached gingiva in single black arrow, while the gingiva that forms a cuff around the tooth is designated as the free gingiva in single blue arrow. This space or the potential space that is created from the tip of the free gingiva to the attachment of the gingiva to the tooth and the cemento-enamel junction is called the gingival crevice in black bold arrow. This space is an excellent environment for pathogens, and the presence of an inflammatory infiltrate is not uncommon. This space is also an area generally targeted during dental cleanings. On your left is the attached gingiva in your white single arrow, provides a protective layer for the underlying bone mandible in this image. Macroscopically, the tissue is firm and immobile with a pink stippled surface. On your right is the forces involved in biting and chewing food, exposing the gingiva to mechanical forces such as compression and shearing. Additionally, the tissues are exposed to numerous microorganisms found in the normal oral flora, and the gingiva is helping to provide a barrier to infection. On your left is an H&E stained tissue section showing a gingiva. The epithelium in this particular location has a parakeratinized surface in single black arrow. The reed ridges are long and in some areas narrow in bold blue arrow. On your right is a section of gingiva showing a fewer reed ridges and has an orthokeratinized surface in single black arrow. The underlying lamina propria contains small capillary loops in single blue arrow. Sparse inflammatory cells and nerve twigs are sometimes seen in the lamina propria. Next is the pigmentation of the gingiva within a population that may vary, such as skin color. However, there tends to be a relationship between the amount of pigmentation seen in the skin and the gingiva. The melanin pigmentation as seen here in bold blue arrow is produced by your melanocytes in white single arrow. Melanocytes lack desmosomes and may have visible dendritic processes that extend between the cells of the epithelium. On your right is the odontogenic epithelial rests seen here in single blue arrow, especially in the posterior areas of your gingiva. On your left is the teeth. Macroscopically, it has a crown, a root, and microscopically, it has an enamel, the dentin, the pulp, the periodontal ligament, and the cementum. There are considerations and variations in your teeth, pitfalls and artifacts. Teeth need to be decalcified for routine H&E slides. The mature animal is lost because of processing. Often the teeth that are submitted are surgically sectioned, losing normal anatomy and histology. Dental restorations may alter or replace your normal histology. With age-related variation, primary or the deciduous type, there are 20 teeth, smaller in size, and they may erupt between 6 to 30 months. We have 8 incisors, 4 canines, and 8 molars. For secondary or the permanent, we have 32 teeth, larger in size, and they may erupt starting approximately at 6 years of age. We have 8 incisors, 4 canines, 8 premolars, and 12 molars. We have changes found in both primary and secondary teeth like hyperdontia, hypodontia. Dentin continues to be laid down with age, reducing the size of dentin tubules and shrinking the pulp chamber. Attrition, abrasion, erosion, caries, and teeth generally darken with age, and teeth may be lost due to disease or trauma. On your left is a graphic showing the mandibular permanent teeth. We have the incisors in black single arrow, the canines in curved white arrow, the premolars in white bold arrow, and the molars in single blue arrow. The teeth will occupy 1/5 of the surface area of the mouth. On the right is the graphic image that show the maxillary permanent teeth, the incisors in single black arrow, the canines in curved white arrow, the premolars in bold white arrow, and the molars in single blue arrow. The maxillary and your mandibular teeth work together for proper eating and speech. On your left is a radiographic image showing the normal full dentition of a child, likely around 5 years of age. All primary teeth are erupted, and developing permanent teeth can be seen within the jaw. On your right is the radiographic image showing the normal full dentition of a young adult. Note that the third molars or the wisdom tooth are not yet erupted in curved blue arrow. The eruption of the first permanent teeth begins around the age of 6 with the first molars and generally ends in the early 20s with the eruption of the third molars. On your left is a graphic showing you the major components of your tooth. The enamel in curved bold black arrow surfaces the crown and supported by the underlying dentin in single black arrow. The pulp in a bold blue arrow is found centrally and communicates with the surrounding bone via the foramen at the apex in curved black arrow. The PDL or the periodontal ligament in single blue arrow is in close association with the root. On the right is the radiographic image, which are components of your tooth that are readily seen. The enamel in curved bold black arrow, the dentin in a single black arrow, the pulp in bold blue arrow, and the apex of the tooth in curved black arrow, and the PDL in single blue arrow. We have the left and H&E showing the cusp of the canine tooth. Due to the demineralization process, the required for routine H&E preparations, no animal is present. We have the enamel, which is made up of inorganic material, primarily of hydroxyapatite satellites. On your right is the enamel matrix in a single black arrow, or the immature enamel, which is less mineralized and can be seen on a routine H&E. Mature teeth do not have the enamel matrix. However, this specimen is from an odontoma. Note also the underlying dentin in single blue arrow. Next is the H&E showing the root of the tooth near the apex in single black arrow. The apex of the tooth is the area where the main foramen is seen. However, smaller accessory foramina may be found anywhere on the root surface. On the right is the H&E showing a cross-section of the pulp chamber as it narrows toward the foramen. The foramen allows for entry and the exit of vessels in bold black arrow and the nerves in single blue arrow. Infection of the pulp may create swelling, resulting in the disruption of the blood supply, and your tooth will die. Next is the high-power H&E showing the dentin pulp complex. The odontoblasts in a single blue arrow form a single layer along the periphery of the pulp and have processes that extend into the tubules. It is the presence of these cells and their processes that makes dentin a sensitive tissue unlike ear enamel. On the right is the high-power view of the pulp showing its loose matrix, which is made up of fibroblasts in a single black arrow, collagen, and ground substance. Note the presence of the small vessels in a bold blue arrow with red blood cells or the erythrocytes. On your left is a PDL in single black arrow providing attachment between the tooth root in white bold arrow and the surrounding alveolar bone in curved blue arrow. The PDL is made up of fibrous connective tissue that allows for slight movement during normal eating and biting. It is also the PDL that allows for the correction of the malocclusion by orthodontic movements. On your right is a high-power H&E showing the relationship of the tooth to the PDL. Note the transition of dentin in single black arrow into the cementum in a bold blue arrow. On your left is a high-power cross-section of demineralized dentin showing the characteristic small tubules in single black arrow. On the right is the high-power longitudinal section of the dentin showing the slight curvature of the tubules in single black arrow. These tubules are filled with fluid and odontoblast processes. The tubules, however, make the dentin vulnerable to invasion of bacteria which may result in dental caries. Severe infection may result in the infection of the pulp in addition to tooth decay of your tooth structure. Left is the insult to the tooth due to caries or mechanical trauma resulting in deposition of reparative dentin in blue single arrow. Seen here adjacent to normal dentin in black single arrow, the reparative dentin has fewer and more irregular tubules. This may be due to the fact that it's likely rapidly laid down in an attempt to protect the pulp in bold black arrow. On your right is a high power view showing a classic basophilic fish scale appearance or the single black arrow of the enamel matrix. Mature enamel, unlike matrix, is destroyed by routine tissue processing. And lastly, your left, the H&E illustrating the enamel matrix. Mature enamel is 96% inorganic and acellular. Unlike dentin, it is non-vital and not sensitive when affected by caries or trauma. Enamel cannot be regenerated or replaced and is unfortunately vulnerable to demineralization by acids in the environment because it is highly mineralized. On your right is a graphic depicting a scanning electron microscope or the SEM image of the enamel. SEM images are primarily used for research purposes. Thank you so much for watching the head and neck part 1. Up next is the part 2 of the head and neck series. This is the Medical Histology Laboratory, and don't forget to like and subscribe to my YouTube channel. Have a nice and wonderful day, everyone. Thank you.